Good day, everyone. Welcome to our special Charity Christmas lecture for the year 2023 on behalf of PAAI. For today's special lecture, we will be discussing Moxibustion, a learn and relearn back to basic TCM acupuncture techniques and associated TCM modality. So let's begin. Um, by attending this lecture or webinar, I hope that you can learn and relearn a lot of things, and hopefully you can apply them in your own respective clinical practices. And one of my favorite saying for the day is, a slow progress is better than no progress. A slow progress is still progress. So by attending this webinar, you are slowly progressing and increasing your skills and knowledge on the basic TCM healing modalities. Okay? So as an introduction, did you know that the Philippine Institute of Traditional Healthcare, or PITAC, has recently released just this August 24 this year regarding moxibustion? So moxibustion is a form of therapy that entails the burning of your mugwort leaves. And in Tagalog, ang moxibustion po ay tumutulong upang pawiin ang pananakit ng likod, arthritis, pananakit ng ulo, paninigas ng kalamnan, pagkapagod, at marami pang iba. So PITAC is actively promoting the art and practice of moxibustion by our fellow Filipino TCM acupuncturists and practitioners alike. Moxibustion dates back way back in the history in the ancient Chinese. If you are reviewing the ancient literature, you would always come across this picture wherein a patient gets to have a moxibustion treatment together by the practitioner and his or her assistants. So usually they do moxibustion on a sitting position at the back so as to treat many disease ailments and as well as regulate the flow of qi and blood in the meridians. So for the history of moxibustion, moxibustion plays an important role in the traditional medical systems of China, Japan, Korea, Vietnam, Tibet, and Mongolia. So they have their own set of books with their corresponding language translations. So moxibustion is quite popular in East Asia. And in the classics, in the inner classic of the Yellow Emperor at chapter 12 of the basic questions, it states that the north is an area where the heaven and the earth are hiding their vital energy as the weather is icy cold. People in the north live on the highland, drink the milk of cow and sheep, and move from place to place. When their viscera are cold, diseases of distension often attacks the people. Moxibustion therapy is a proper treatment, so moxibustion therapy spread to the country from the north. And in the excerpts of the ancient literature, chapter 73 of the Lingshu or Miraculous Pivot states, a disease that may not be treated by acupuncture may be treated by moxibustion. Likewise, in Introduction to Medicine, it says that when a disease fails to respond to medication and acupuncture, moxibustion is suggested. So in your practice, in your respective clinics, if you are doing moxibustion, it is a very good arsenal or TCM technique to have and to practice because it greatly supplements your acupuncture modality. Not to mention, moxibustion is non-invasive, so this one is perfectly suited for those that are afraid of needles. Not to mention, this is a very good TCM modality to boost one's health and wellness. So what is moxibustion? Let us define moxibustion. Moxibustion is a traditional Chinese medicine therapy which consists of burning dried mugwort on particular points on the body. It is a traditional Chinese medicine technique that involves the burning of mugwort, which is a small spongy herb to facilitate healing. The scientific name of the mugwort is Artemisia vulgaris, and it is a species of chrysanthemum. According to the books, moxa produced from Chicho is known as the best kind of moxa as the climate and soil are good for its growth. So for those of you wondering what the moxa plant looks like, so this is our Artemisia species, Artemisia vulgaris, and in Filipino, it is called as Damong Maria. So this plant is where moxibustion is derived from. So they process this plant so as to make your moxa sticks, moxa wool that can be used for moxibustion treatment. And in a new edition of Materia Medica appears the following description for Artemisia vulgaris. The moxa leaf is bitter and acrid, producing warmth when used in small amount and strong heat when used in large amount. It is of pure yang nature, having the ability to restore the primary yang from collapse. So this is most especially suited for patients suffering from yang deficiency, or in the Western counterpart for those suffering from shock-like cases, hypovolemic shock, cold extremities, dehydration. Yes, you can use moxibustion. Not to mention, it can open the 12 regular meridians, traveling through the 3 yin meridians to regulate your qi and blood, like acupuncture, expel cold and dampness since it is of a warming property, warm the uterus, stop bleeding, warm the spleen and stomach to remove stagnation, regulate menstruation, and ease the fetus. When burned, it penetrates all the meridians, eliminating hundreds of diseases. Yang Qi can be activated by the artemisia leaf for its warm nature. So, moxibustion most likely, most importantly, tonifies your Yang Qi. It can also tonify Yin in a sense, but it most focuses more on our Yang Qi. The acrid odor of the leaf can travel through the meridians, regulate qi and blood, expel cold from the meridians, and its bitter nature resolves dampness. So the moxa leaf, the property, the nature, or the flavor of that is more or less leaning towards bitter. Bitter nature can resolve dampness, especially when you have a lot of damp pathogens in your body. So what are the functions of moxibustion according to TCM? We have 4 major functions. Number 1, it's to warm the meridian and expel the cold, to induce the smooth flow of qi and blood. Number 3, to strengthen the yang from collapse. And number 4, to prevent diseases and keep healthy. So in warming meridians and expelling cold, we know that the abnormal flow of qi and blood usually result from cold and heat, with cold slowing or stagnating your qi flow and the heat promoting rapid flow of qi. Treating diseases caused by cold dampness and persistent diseases caused by pathogenic cold penetrating into the deep muscles. So moxibustion is most suited to warm meridians and expel cold pathogens. And in chapter 75 of your Miraculous Pivot, it states that if stagnation of blood in the vessels cannot be treated by warming up with moxibustion, it cannot be treated by acupuncture. So these are ancient old sayings because the ancient physicians, most of them would practice your direct moxibustion during those days. And they found that moxibustion is equal or maybe even better than acupuncture. Hence, we always used to see in the books that acupuncture and moxibustion goes hand in hand together. And in chapter 48 of your Miraculous Pivot, it states that depressed symptoms should be treated by moxibustion alone because depression is due to blood stagnation caused by cold, which should be dispersed by moxibustion. So again, remember cold pathogen, most suited modality for that is moxibustion because moxibustion is of a heat or a warming modality. Number 2, like acupuncture, moxibustion can induce the smooth flow of qi and blood. Chapter 64 of your Miraculous Pivot points out that when there is an excess of qi in the upper portion, the qi should be brought downward by needling the points in the lower portion. So, for example, you have a hyperactivity of liver yang or liver yang syndrome. When you do moxa at kidney 1 at the sole, because the upward flow of yang qi, your moxibustion will do is that it will lead the qi and blood to go downward instead of accumulating at your upper portion. So that, in a sense, can reduce your high blood pressure, red eyes, irritability, because moxibustion directs their qi and blood flow to go downward. Likewise, for cases of anal prolapse, uterine prolapse, and prolonged diarrhea, moxibustion at do 20 at the top of the head, at the top of the scalp, due to sinking of qi and excess in the lower portion of the body, so as to lead yang qi to flow upward. So in the ancient classics, you would always see the prescription of do 20 moxibustion, direct moxibustion, for cases of sinking of the qi, such as your anal prolapse and uterine prolapse. Because when you do moxa at the upper part, you are inducing the qi and blood to flow upward. Okay? So the third function is to strengthen the yang from collapse. So as we all know, yang qi is the foundation of the human body. If it is sufficient, you will have a long life. If it is lost, it will cause death. So moxibustion applied can reinforce yang qi and prevent collapse. So usually this one is used for cases of along the lines of shock, coma, because most of the time you have a collapse of yang qi. So to rescue that, moxibustion is also a very good treatment option to do for this kind of patients. And in chapter 73 of the Miraculous Pivot, it states that deficiency of both yin and yang should be treated by moxibustion. So it's not only for yang deficiency, but yin deficiency as well. That's why the ancients practiced moxibustion as a wellness modality, hence giving you the fourth function, which is to prevent diseases and keep healthy. This is the fourth and last main function of moxibustion according to the TCM classics. And in Precious Prescriptions appears the following description. Anyone who travels in the southwest part of China, such as Yunnan or Sichuan provinces, should have moxibustion at 2 or 3 points to prevent sores or boils and to avoid pernicious malaria, epidemic diseases, and pestilence. So in a sense, it is a wellness or a prophylactic therapy during the ancient days, wherein prior to traveling to this province, people would do moxibustion at 2 or 3 points so as to prevent this toxin invasion. And in Precious Prescriptions, it often states that if one wants to be healthy, one should often have moxibustion over the point stomach 36 or your Susandi. I'm very sure most of you at your point in career have punctured one way or the other. The most important point is stomach 36 because that is the true earth point or the earth point of the earth meridian, specifically great in boosting your acquired chi, and it can help boost immunity. So earth. So when you boost the earth, it can give birth to your metal and likewise indirectly influence all your Zangfu organs. So stomach 36 is a must-know point for all of us. So if you don't like to do acupuncture there, doing moxibustion there daily by the ancients, usually it's used to promote health, and that is attributed one of the factors why they have very good long lives and they're healthy. And in the notes on Bienche's moxibustion, it says that when a healthy man often has moxibustion on the points of CB4, CV6, GB4, and CB12, he would live a very long life, at least 100 years of life. Because CB4, the gate of the primordial chi, and Chi Hai, CV6, the sea of chi, together with Mingmen, the gate of life, and Chongwan, CV12, they are all used to boost the production of chi and blood, your acquired chi from your food essence. Not to mention, it strengthens your yang chi, especially at the gate of life. So when all of these are taken all together, it can help boost one's chi and blood circulation in the body, thereby promoting immunity, preventing diseases, and keep healthy. So this has been stated in the ancient classics. And for those of you, if you forget where they are located, worry not, because I have here a table about your energy acupuncture points. So I'm very sure most of our Reiki practitioners, TCM acupuncturists are familiar with these points. So if you remember, REN 17 is on the anterior midline of the upper chest. It is between the two nipples, close relation with the lung, and it can help boost your pectoral chi, and it is good at dilating the chest and regulating the flow of chi. Other, other energy points at the lower abdomen, you have your CV6 or REN6, and together with CB4 or REN4, they are located at the lower abdomen. 1.5 tsun below the umbilicus for CV6, and 3 tsun below the umbilicus for CB4. So they are most likely vital for promoting your yuan or primary chi or primary energy in the body. So not to mention they are in close relation with the kidney. So these are very good energy points where you can apply moxibustion. Most commonly, aside from stomach 36, you can apply moxibustion daily at CV6 and CB4 for health and wellness. Okay? So moving forward, let's discuss now the different preparations of moxibustion. So for materials going to be used for moxibustion, we have the moxa wool, your cones, your sticks, your matches and lighter, and the tray, of course. So for the making of moxa cones using a moxa wool, you place a small amount of moxa wool on a board, knead and shape it into a cone, a triangular shaped cone, like a small mountain, with the thumb, index, and middle fingers. In the olden days, it is measured as a small, medium, and large, with the smallest like the size of a grain of a wheat, the medium size, it's as half a date stone, and the large size, it is considered to be the upper part of the thumb. And for the small and medium moxa, usually you use them for direct moxibustion, wherein your moxa wool is in direct contact with your skin, whereas the large moxa cone, you use them for indirect moxibustion. So in modern measurements, the small, medium, and large moxa cones are measured 2 to 5 millimeter in diameter and 4 to 8 millimeter high. For the medium size, it's 6 to 10 millimeter diameter and 9 to 13 millimeter high. And for the large one, it's 11 to 15 millimeter in diameter and 14 to 25 millimeter high. So that's roughly approximately 2.5 centimeters or 1 inch for the large moxa cone. Once you make your moxa cones into a triangular shape, it's either you get a incense or a lighter, long nose lighter, or some ignition material so as you can light your moxa cones. And you can do to stimulate the parts or the acupoints you wish to do moxibustion. Like for example, the umbilicus is here. Most likely this person is doing a moxibustion at stomach 25. So moxa cones are used for direct moxibustion. If you don't like the hassle of doing moxa cones, you can also opt to do moxa stick. Moxa stick, easy to buy. It's like a cigar, 1.5 centimeter in diameter, 20 centimeters in length. Or you can do it on your own. Simply roll a moxa wool into the shape of a cigar using paper made of a mulberry bark. So what does it look like? So moxa sticks looks like this. Most likely moxa sticks are used for indirect moxibustion. So this one, it is very simple, easy to do. You can do it yourself or the patient themselves, holding the moxa stick to use the heat to penetrate and stimulate your respective acupuncture points using the heat property of the moxa leaf. Okay? And moving forward, let's now go to the classifications of moxibustion. Moxibustion generally is classified into a cone, a stick, and a warming needle. But the two general classification would be it's either direct moxibustion or indirect moxibustion. Under direct moxibustion, we have the scarring and non-scarring moxibustion. Indirect moxibustion, we either use the moxa sticks or a TCM herb medium, which can be a ginger, a garlic, and a salt insulation, or even a aconite or monkshood cake insulation. So a more pictorial view for you to appreciate it. Direct moxibustion, when you say direct moxibustion, the moxa per se is in direct contact with the skin. Indirect moxa, you don't touch the skin. You use a medium in between or a suspended type of moxibustion. Sparrow pecking moxibustion is a technique using a moxa stick. It is more or less a reducing type of moxibustion. And some of you, I'm very sure you combine acupuncture and moxibustion. Hence, you do a warming needle moxibustion. Let us first discuss direct moxibustion. So direct moxibustion, moxacone is placed directly on the point and ignited. It is also known as open moxibustion. It is used in the ancient times with better results, divided into scarring and non-scarring. So direct moxa, as long as it touches the skin, That is called direct moxibustion. So the two types again would be the scarring moxa, which is also known as your festering moxibustion. So prior to moxibustion, you apply some onion or garlic juice to the site in order to increase the adhesion of the moxa cone to the skin. Nowadays, instead of onion or garlic, they just use water, our basic tap water. Then put the moxa cone on the point and ignite it until it completely burns out. So scarring moxa, you repeat the procedure for 5 to 10 units. And when you do a scarring moxa, it leads to a local burn, a blister, a festering, and scar after healing. So usually you use this for chronic diseases such as asthma, complex diseases, very challenging diseases, autoimmune disorders, cold syndromes, pneumonia, TB, cancers of cold type. So usually, the ancient physicians would tend to lean more for scarring moxibustion. And a picture of a scarring moxa here in CV6, as what you can see after the moxa cone is placed, 5 to 10 units are ignited, and of course, you will leave a scar that is expected. Hence, it is called scarring moxibustion. Other areas, you might get blisters, wounds, and blister fluids. Because the blister fluids, that is a usually by a burning material. So definitely you would have incur blisters. But did you know that the blister produced by a scarring moxa is very different from a blister produced by a burn injury? In modern research and scientific analysis, they found out that the blister fluid from a scarring moxa is actually sterile, meaning it doesn't contain any bacteria. It is full of immunoglobulins, cytokines, and other proteins in the body. So it's a mechanism of the body to detoxify. Whereas a blister from a burn injury, let's say a first or second degree burn, when they analyze it in a microscope, they would tend to find that moxibustion blister by burn injuries are tend to be unsterile, or it is full of bacteria and other inflammatory metabolites. So what this does say to us that the ancient practice of scarring moxa may have benefit in terms of regulating our health by means of detoxifying, activating certain immune pathways, and promoting overall health. And again, the other counterpart of scarring moxa would be the non-scarring moxibustion. So this is similar to scarring moxa, except that you don't let the moxa cone to be completely burnt out. When half or two-thirds of it is burnt, and or the patient feels a hot or a burning discomfort, so you remove the cone and place another one. Once the patient feels a hot or painful or a burning discomfort, chances are your temperature in the body is approximately already at 44 degrees Celsius, because that is where the noxious thermal stimuli happens, and there should be no blisters, festering, and scar formation. Hence the name non-scarring moxibustion. What are the indications? It is indicated for chronic, deficient, and cold nature, such as your asthma, chronic diarrhea, indigestion, other cold syndromes as well. Okay, so a very good example of non-scarring moxibustion is this. So you do a non-scarring moxa at bladder 67. So take a look. After the moxa cone, once the patient starts to feel heat, you will tend to remove the moxa cone. You don't let them burn totally. Okay? So that is your non-scarring moxibustion. You remove the moxa cone prior to being consumed, and you reload and replace for another moxa cone and repeat the procedure. So that is an example of a non-scarring moxibustion. So again, this is done at bladder 67. Okay? So this is an example of non-scarring moxa. Okay? And repeat it for another third time. Okay? So moving forward. So indirect moxa, aside from that technique, you can also do the insulation. Insulation by means of four materials, most commonly would be our ginger, garlic, our salt, and monkshood cake for the TCM herbologists. So moxibustion with ginger. Generally, the recommended slice of a ginger is 0.5 centimeters thick. So before you put that in the umbilicus, make sure to put numerous holes in it, either by puncturing it with a sterile acupuncture needle and place it on the point selected so as to help the moxa penetrate your acupoints much more effectively. So on top of the ginger, a large moxa cone is placed and ignited. When patient feels it scorching, remove it and light another. So, ginger moxibustion is indicated in symptoms caused by weakness of the stomach and the spleen, such as your diarrhea, abdominal pain, painful joints, and symptoms due to yang deficiency. So here, example of our ginger, then you cut them into coin-like sizes, and then you put a moxa cone in between. It is highly recommended you put a margin of allowance, a more bigger ginger slice, so that when you remove your moxa cones, you can just pick up the ginger directly. So that is recommended. And then when you put your large moxa cones here at the umbilicus and ignite it respectively. So this is generally how ginger moxibustion is done. Also, for moxibustion, you can also do your moxibustion with garlic. So garlic, just like ginger, you slice it at about 0.5 centimeters thick. A large single clove of garlic is desirable. Punch numerous holes in it and place it on the point selected. On top of this garlic, a moxa cone is placed and ignited, and you renew the cone when the patient feels it scorching. So usually it is indicated for scrofula or tuberculosis. Scrofula meaning TB of the lymph nodes, your cervical lymph nodes, and the early stage of skin ulcer with boils, poisonous insect bite, etc. So much like ginger moxibustion, you just change the material into garlic slices, and you use a smaller cones for this one, since garlic is of limited size. So when you do your garlic moxibustion, you can put it on several points or even at the umbilicus to help do the moxibustion heat penetrate using the garlic property of heat, and you can exert your moxibustion effects more effectively. So very much similar with our ginger moxibustion. You just use garlic. Garlic also has the property of hot. So when you do a moxa plus garlic, you can easily tonify your yang. Another common ingredient that most people use would be salt. So salt is applied at the umbilicus or your CV8, REN8. So you fill the umbilicus with salt to the level of the skin, place a large moxa cone on top of the salt, and then ignite it. And then you renew the cone when the patient feels it is scorching. So moxibustion with salt is effective for abdominal pain, vomiting and diarrhea, pain around the umbilicus, pain caused by hernia, prolonged dysentery, etc., etc. So it has also the function to restore yang from collapse, which has the following symptoms of excessive sweating, cold limbs, and undetectable pulse. A large moxacone may be used successively until the sweating stops, pulse restores, and four extremities get warm. So one thing I want you to remember, salt. So salt is very common. So you can fill that to the level of the umbilicus and put your moxa cones there. Not to mention, it can rescue yang. Salt is also a property or belongs to kidney. So it has an affinity to the kidney. So when you use salt, aside from tonifying your yang qi, you can also help tonify the kidney. Because remember, your salt, the affinity of salt belongs to the kidney organ or to the kidney zang organ. And other less common ingredient is moxibustion with monkshood cake or your aconite. So much like ginger and garlic, you use a coin-sized cake made of monkshood powder mixed with alcohol and punch with numerous holes in it. Since the monkshood cake is of heat nature, monkshood may warm yang and expel cold. And it is useful for persistent yin cold syndromes such as your impotence, and premature ejaculation caused by declination of the Mingmen or your Do4 at the back at the level of L2 below the spinous process of L2, which is also known as the vital gate. So a dried monk shoot cake looks like this. You can cut them into coin-like sizes and put a moxa cone and then put it on the umbilicus or your Do4, the gate of life, to help boost or rescue your yang. So that can help with persistent yin cold syndromes. So if you don't like to use the moxa cones, some people would opt for moxibustion sticks. Moxibustion sticks, you apply a lighted moxa stick over the selected point. That is easy to control the heat and time during moxibustion, and the therapeutic effect is good. So it may be divided into mild warm moxibustion, sparrow pecking moxibustion, and warming needling. So the moxibustion stick developed in the Ming Dynasty is a convenient, less time-consuming, and easily controlled method of applying moxa directly. So aside from the traditional moxa stick, the smoke moxa stick, nowadays it also has the advent of the smokeless moxa stick. But if you ask me personally, I would lean more for the smoke moxa stick because the smoke of the moxa also has pharmacologic effects and beneficial effects to the body. So how do you do it? So the moxa stick is lit at one end and held at about 1 inch from the skin, like in this picture, and burned for up to 15 minutes or until the skin around the area is bright red. So people are asking me, Doc, for you to consume one whole cigar or one whole stick of moxa, how long? Approximately 15 to 30 minutes. It's 15 to 30 minutes, but usually case to case basis, whether you want to consume all parts of the moxa stick. Other people will just do directed targeted moxa. So a moxa stick, once ignited, it is held 1 inch from the skin to stimulate your acupuncture points. Some people have an assistant to do it. Other people, you can do it yourself, like your daily moxa stimulation point at stomach 36. Others would use a accessory box for your moxibustion sticks. So for me personally, I use moxibustion sticks a lot because it is safe, easy, convenient, and very easy to do. Just make sure, be careful not to let your ashes fall down to the patient's body. Always make sure, double check your moxa, remove the excess ashes so as not to cause burn injury. The beauty thing about the moxa stick, it can be self-administered or administered by a professional therapist. For your patients, you can do it at home provided they have good ventilation. So it is a very good home care activity for boosting one's health and wellness. So, moxibustion by moxa sticks. You have mild warm moxibustion, wherein you apply an ignited moxa stick over the point to bring a mild warmth to the local area for 5 to 10 minutes or until the local area is red. So again, the distance at least 1 inch, and then you stimulate the acupoint up until the patient tells you it is already hot or too hot or quite discomfort. That's the time you remove and you restimulate or stimulate another acupoint. Okay? So a sub-technique of moxa stick is sparrow pecking moxibustion. So an ignited moxa stick is rapidly pecked over an acupoint, paying attention not to burn the skin. So it's like a sparrow pecking on a tree. So an ignited moxa stick may be evenly moved from left to right or in circular movement. Some people, they do circular motion of moxa stick sparrow pecking method. So generally, a sparrow pecking is actually, for example, this is your acupoint. You peck like up and down, up until you stimulate the points. Repeat that for several times up until the patient feels the heat penetrates deep down to his or her body. Just be careful not to touch the skin with the burning moxa, otherwise you might cause your burn injuries. So be careful. Be cautious when applying your sparrow pecking moxibustion. Always double check your ignited moxibustion stick. Common here in the Philippines, most of you, I believe some of you are very familiar or practicing with warming needling. So this is a combination of acupuncture and moxibustion. So with the needle retained in the point, you wrap the needle handle with a unit of moxa wool and ignite it to cause a mild heat sensation around the point. So usually you use this for painful knee joints, arthritis syndrome, B syndrome, also for boosting immunity. It functions to warm the meridians and promote the free flow of qi and blood. So it is also used to treat the painful joints caused by cold dampness, numbness with cold sensation, and paralysis. So for moxibustion with a warming needle, for example, at Sanjiao 5 or triple burner 5, you do an acupuncture, then you put a moxa cone, and then you ignite the moxa cone. A general rule of thumb, a safe distance between the moxa cone and the skin, at least 1 inch or 2.5 centimeters is the recommended to at least exert therapeutic effect with moxibustion via warming needle. So remember, a general rule of thumb for moxa cones using warming needling, at least 1 inch distance. Repeat the unit for 3 to 5 times. And also some people would put foils, papers at the skin area so as to protect the burning ash from touching the patient's skin. Not to mention when you put a paper or aluminum at the aluminum foil at the acupoints, not only to protect from burning ashes, it also helps to keep the warmth in the area because your paper or aluminum foil can act as an insulation to keep the heat within the acupoint area. So it has a dual function of safety and more efficacy. So for those practicing with warming needle, always remember, again, 1 inch is the safe distance, 1 inch. So Dr. Webb, what are the moxibustion health benefits? So some studies have shown that moxa burnt over specific parts of the body can help with activating immune functions and increasing the RBC and WBC count. It can also enhance the lymphocytes and other NK cell activity that can help with overall immune system, heal wounded tissue, and the revive of organs which have lost their capacity to function optimally. So this is very suitable for deficiency cases of your respective Zhang organs. Not to mention, it lowers blood pressure as what I have told you a while ago. You direct the moxa, the chi and blood to flow downward using a moxa cone at kidney 1, reduce blood viscosity and dilate various vessels. So moxibustion can help dilate the blood vessels. Not to mention, it can help detoxify the body, strengthening one's overall health and well-being and improving the immune function. So it has also been proven to provide effective support for chronic pain, pain syndromes, B syndromes, immune system disorders and breakdown, autoimmune disorders by regulating one's immunity, lymphatic disorders requiring drainage, eyesight pain and blurriness, skin disorders. So indirectly, it can help by boosting one's immunity so as to help avoid the flare-ups of this problem. And very famous for muscular tissue tension, injuries and blockages, pain syndromes, arthritic cases, yes, strained injured ligaments and tendons, yes. For those with chi and blood stagnation, remember your moxibustion can promote the free flow of chi and blood much like acupuncture. You can also use it for arthritis or rheumatism of the muscle and the joints, tendonitis, carpal tunnel syndrome, nerve joint inflammation, repetitive strain injuries. Moxibustion is quite suitable for this kind of cases as it can help unblock your meridian and regulate the free flow of chi and blood, much like acupuncture. For internal conditions such as your digestive disorders, your gastroenteritis, diarrhea, indigestion, poor metabolism, food poisoning and bronchial asthma, moxibustion can warm the spleen and stomach, helping their production of your acquired qi, thereby promoting immunity, indirectly helping with the healing of these following disorders. Other cases, such as your pancreatic weakness and cleansing, kidney and gallbladder stones. Important thing to remember, they help more for the kidney function per se, also for the pain relief, but they do not directly dissolve your stones. So always explain properly that moxibustion helps boost the function of the organs, and they cannot directly dissolve your kidney and gallbladder stones. So moxa functions as an auxiliary support. A very famous application of moxibustion nowadays is for couples wanting to conceive. So these are more important for fertility boosts among men and women, more specifically for women at the area of the uterus. Not to mention, it can help with menstrual disorders, cramps, dysmenorrhea, PID, menopause. It can help for regulating one's hormones and dispelling the cold attacking the uterus. Not to mention, for prostate issues and heart weakness, moxibustion can help with that as well. So moxa has a wide range of health benefits affecting the overall body system. So moxibustion is a very good TCM modality to practice. So moving forward, some very important key points for moxibustion. So with regards to the process and the volume of doing moxibustion, the Precious Prescriptions points out that moxibustion is generally applied to the yang portions first, then to the yin portion. Clinically, it is applied to the upper part first, then to the lower part. Treat the back first because the back is an area of the yang, and the abdominal region the second because it's an area of the yin. The head and the body first, and the four extremities the second. But at the end, it is always that the sequence should be given according to the pathological conditions. So these are, in a sense, a general guide when doing moxibustion. But if you, based on your assessment and diagnosis, one can also give moxibustion process according to the pathologic conditions or the problem area per se, which is a very common practice, much like we needle our Acupoints when doing acupuncture. So, also, the volume for moxibustion, including the size of the moxa cone or the duration of the moxa stick application, should be in parallel to the patient's pathological conditions, general constitution, age, and the site where moxibustion is to be applied. So, so again, TCM diagnosis, your personal assessment as a practitioner is of utmost value. So this is, remember, this is just a guide. So when based on your clinical judgment, you can also modify it accordingly to your according to your clinical judgment and your clinical treatment plan. Okay, some other useful guides. So whenever you're in doubt, the Precious Prescription points out, usually when you use a moxa cone, the recommended is 3 to 7 moxa cones for each acupuncture point. And then for those using moxibustion stick, 10 to 15 minutes for the application of moxa sticks, not only per point, but multiple points as well. So again, this is a general guide on how much you should do moxibustion in terms of moxa cones and moxibustion stick. A very common findings nowadays, it's the so-called heat-sensitive moxibustion. So this is very much similar to our acupuncture in terms of balancing, wherein you find your ashi point. So meaning not exactly on the located acupuncture point, but on the reflection areas per se. So in moxibustion, it has a counterpart. It is called heat-sensitive moxibustion. So there have 6 different types of heat-sensitive moxibustion. The first one is heat getting inside. So here in this picture is that when you perform moxa, the heat of the moxa won't just stay on the surface of the skin but can transfer to the inside of the body. That is one type of heat-sensitive moxibustion. A second type of heat-sensitive moxa is when you do a moxa at a certain acupoint, let's say at CB12 or stomach 25, the heat, instead of going downwards, it spreads across the local area. So, for example, you do a moxibustion at CV6, and then the patient feels that the heat penetrates at CV8, CV4, CV3, and CV2. That is also a type of heat-sensitive moxibustion. The third type of heat-sensitive moxa is your heat extending, wherein you perform moxa on an acupuncture point. The heat will not stay only on an acupuncture point, but will also transfer along the channels. So for example, when you do a moxibustion stimulation using a moxa stick at the due meridian, the heated area is not only at the acupoint. The patient can say also that the heat kind of flows to the due meridian upward all the way towards his spine to the area of the neck. So that is not an abnormal phenomenon. That is also counted as a heat-sensitive moxibustion, wherein, if you remember, moxibustion promotes the free flow of qi and blood. And the fourth type of the heat-sensitive moxa is wherein you do a moxibustion at an area, the surface doesn't heat, but inside the skin heats. So basically, this one states that the surface is not heated, but the deeper part of the tissue is heated. So some patients can tell you this sensation that can also count as heat-sensitive moxibustion. And number five is that when you do a moxa, the local area doesn't heat up, but rather a far area. So for example, you do a moxibustion at Du4 or the Gate of Life Mingmen, it's possible that the patient can tell you that his SI meridian or SI11 heats up or GB21 heats up, yet you apply a moxa stick at a far away area. So some patients can report that sensation. Worry not, that is also considered as a heat-sensitive moxibustion. And last but not the least is a false heat feeling. So a false heat feeling is generally any of these five, or when you do a moxa, the patient feels very weird. Not only feeling heat, but feeling relief or comfort. So all these six types belong to the category of heat-sensitive moxibustion. So heat-sensitive moxibustion, according to our Chinese doctors nowadays, they are more appropriate than the traditional moxibustion. So if ever you encounter any of these five sensations reported by your patient to you, worry not. Tell them this is a phenomenon of heat-sensitive moxibustion wherein your moxa heat stimulates your acupoints and meridians, hence inducing the free flow of qi and blood, hence restoring yin and yang balance to an equilibrium, thereby achieving homeostasis in the body. So remember that this is a very good or newer concept, modern concepts about moxibustion. Okay? So moving forward, let's now go to the contraindications of moxibustion. Well, in the book, it always states that moxibustion is contraindicated for excess syndrome and heat syndrome, which includes high fever caused by common cold or heat due to yin deficiency, are not allowed to be treated by moxibustion. However, did you know an ancient saying of the moxibustion is to use the toxin to remove the toxin and to use the heat to reduce the heat? This has been mentioned in the ancient classics. So for example, for using the toxin to remove the toxin, an example would be garlic moxibustion for insect sting and poison bites. You use the toxin, quote unquote toxin of the garlic to treat the toxin of the insect sting or poison bite. And then for using heat to reduce heat, this is a very good example wherein this patient, teenager, has multiple insect bites lesions caused by ticks and fleas. So if you can see, They are sore, itchy, red in color, an indication of heat and toxin penetrating the body. So what I did, instead of doing prescribing antibiotics and the other antihistamines, we use moxibustion. So when I did the moxibustion at this patient, the patient did report that the itching felt very reduced, and the sensation of the moxa dispelling the wind or itchiness is very comfortable. So not only moxibustion, but I also did an acupuncture to help regulate the immunity. And lo and behold, for the following day, what you can see the day after, just one day, no? Wala, not yet even exceeding 24 hours, you can clearly see that the red lesions, most of them lightened up, some of them were reduced. And when we ask the patient how he or she feels, he feels very comfortable, not that more pustulating or suppurating lesions. Itchiness has decreased tremendously. So I asked him to continue the treatment so as to eradicate all, and also treat the house for those insects that cause his bites in the first place. So this is a very good example of using heat to dispel heat, as seen in this case. Okay, next. Treatise on febrile diseases states that a patient with a feeble and rapid pulse should not be treated by moxibustion. Although the heat of moxibustion is weak, strong internal impact may produce. So feeble and rapid pulse indicates a heat syndrome. So usually in the books, heat syndromes not recommended to do moxibustion. But again, if you saw what I presented earlier, experience would state otherwise. So we now begin to challenge the old theories and concepts by the book. So sometimes your experience teaches you more. Also, number two, scarring moxibustion. Scarring moxibustion should not be applied to the face and head or the area in the vicinity of the large blood vessels. So for the face and the head, do not apply direct moxa, especially or scarring moxa. What about indirect moxa using a suspended moxa stick? Yes, possible. You can apply. You can also apply at the facial area your ginger moxibustion. The one contraindicated is a scarring or direct moxibustion. Not to mention some acupoints where scarring moxa is contraindicated will be bladder 1, which is very near the eyeball. So if you do a scarring moxa there, you do not want to injure the eye of the patient. So of course, common sense would tell you that you avoid doing a scarring moxa at bladder 1 as well as stomach 9 near your carotid artery. So these points, avoid doing scarring moxa. Indirect moxa, yes, possible. You can do indirect moxa. What about pregnancy? Pregnancy is not allowed to use moxibustion on the abdominal or the lumbosacral region of a pregnant woman. What about upper back pain? Upper back pain, yes, you can. You can. You can do a mild moxibustion or reinforcing type of moxibustion. You can stimulate it lightly. So just like acupuncture, you avoid the acupoints that are contraindicated during pregnancy, such as your spleen 6, Li4, so avoid them. And even GB21, no? So try to avoid them when doing acupuncture or moxibustion on pregnant patients. So for post-moxibustion, different degrees of burns may remain in the local region. Most common side effect when you do moxibustion, there is a slight red sign of burning which will disappear very soon, or the skin area where you applied your moxibustion can have redness. That is common, much like when we do acupuncture. Some of you, I'm sure you observe at around the needle area goes red. So even without doing moxa, the needle area goes red. So that's an indication as well in modern science. It is an axonal reflex wherein your blood vessels at the local area dilates, hence causing that flushing phenomenon around the acupuncture points. So for moxibustion, that's also possible. Post-moxa care. Sometimes you would encounter blisters. So again, much like dry cupping, Small blisters, we allow them to heal spontaneously. We don't do anything. For large blisters, you can puncture and drain them accordingly. For blisters with pus, you can puncture and drain and dress to prevent further infection. Make sure to do your daily wound cleaning. Hopefully, you don't incur much blisters in your treatment. But if again you're doing scarring moxibustion, definitely one can expect that you would incur blisters. Okay? So these are the general recommendation for aftercare when doing a moxibustion treatment. So what about the equipments for moxibustion? Some people would use a moxibustion stick holder holding multiple moxa sticks at one time. So this is a special equipment for doing moxibustion. Other people would buy accessories such as a hammer that can fit a normal moxa stick. So in the hammer you have a an insulating material together with a aluminum foil that can stimulate your acupuncture points. So these are accessories. These are optional if ever you feel comfortable using them. Some of them would use a metal rod to hit the local area. Although personally, I don't like to use them because remember, when you put a moxa there and you ignite it, heat. This is a metal. So remember, heat will transfer to metal more intensely. So it's like scalding the patient using a hot metal, no, or a poker. So for me, I don't like to use this because when this touches the skin, it is very painful. So not to mention when you're going to refill or reload your moxa sticks, it is also a challenge. So for me personally, I don't use this, but I'd like to show you that some patients do buy moxibustion accessories that can help them render their moxibustion daily practice in their homes. Others would go for the pouch. So the pouch looks like this. It has a belt strap. And when you open it, this one, here you can put your moxa cones inside, then lock it in, then put this circular equipment inside the pouch, and then you put the pouch either at your acupoints or at the umbilicus. Yes, you can. Remember to put an insulating material because again, this is metal. Metal conducts heat very intensely. So when the metal touches your skin, a very hot metal, you can induce burn injury. Much like these other accessories as well, this is also metal, but some practitioners use this. You put some moxa cone, a stick, or a wool to heat, and then the holes would help the heat penetrate. Although for me, I don't practice this. But some of you, if you're practicing this one, just be careful not to burn the patient. Okay? Be very careful of the hot burning metal. Some people, they use a moxibustion box. So wherein several moxa cones are placed in the box to help stimulate a wide area of moxa points. So a moxibustion box is also a very good tool to have. For me, I use a moxa box because you can do it easily. Second, the moxa box, you can leave it and you can have someone monitor it for you. So for me, I use a moxa box, especially on the lower abdomen. Very easy, very convenient, and sometimes you can instruct the patient to adjust the box based on their preference. Other practitioners would use a moxibustion adhesive, such as multiple moxa cones or moxa sticks with adhesives that can be placed on certain acupuncture points. So the advantage of this one, you can stick it at certain acupoints, just like here, your lung 11 or your Jingwell points. Yes, you can. Although some people don't like to use this because number one, some are allergic to the adhesiveness of the tape. Like me, I'm allergic to that, so I don't use this. I still go with the traditional holding of the moxa stick per se. But this one, if you're practicing this one, just make sure it is stable and do monitor your patient when you're doing your self-adhesive moxa. For smokeless moxa, same. There's also adhesive. Some have cones, others have sticks. So smokeless moxa has the advantage of quote unquote less smoke or totally smokeless. So for those practicing in clinics, at the mall, air conditioning, at condominium, this one might have a more useful application. Other modalities, they use the Moxibustion glasses, wherein it is a special type of tool, most likely used to use the moxa heat to penetrate the Moxibustion acupoints at the facial area at the eyes for presbyopia, vision problems. So you use a walnut to shield the heat from the moxa. So these are newer modalities. So they develop more and more accessories for moxibustion use, suiting different kinds of cases. Okay? So moxibustion, an ancient technique, would include your long snake moxa with either ginger or garlic. So this technique involves the dew meridian or your governing vessel meridian. So using ginger, garlic, a moxa floss, and a fire. It is indicated for conditions that result from cold and deficiencies of yang. It is a more extreme type of treatment. So it utilizes both the primary and collateral dew meridian from the base of the spine up to the neck at dew 14 or GB14, and thus it strongly affects the chi of the whole body. So it functions to supplements the yang, warms the channels, expels the cold, expels the wind, strengthens the spine. A little reminder, because garlic and ginger is a skin irritant, varying degrees of irritation may occur, including blisters. Most especially if you're using garlic. Ginger is more accepted or tolerable. So for me, between the two, I would tend to lean more using ginger when I do my long snake moxibustion. So to perform this technique, you will need to prepare several items: your medical gauze, scissors, isopropyl alcohol, lighter, most especially, ginger and garlic. Also for me, I use 300 grams of ginger, grinded ginger, loose moxa, and a food processor so as to mince and mash your ginger or garlic. So finely chop the ginger and the garlic, and then you use a gauze to place at the whole dew meridian so as to serve as a barrier to the skin and will help cleaning up post-treatment much easier. So much like this TCM doctor does, using the scissors and the gauze, putting gauze at the back of the patient at several layers to help protect the patient from burning moxa intensely, and then you put your garlic or ginger mixture over the spine, starting at the base of the spine, moving up from C7 all the way to the thoracic one, or down the way all the way to the do4 meridian. So you pat evenly the ginger or the garlic so that it is flat and even. Once the ginger garlic mixture is flat and even, moxa wools is next to be placed, much like their moxa bag here. And then you will slowly put the moxa cone, align them together, creating a layer of moxa. Start at the base of the spine, continue adding the moxa gently and evenly across the whole spine, much like making a great wall of China. So once the completely layered, pinch the top aspect of the moxa layer into a crest. Some people, they do a depression, slight depression here for more stability. And other practitioners, they would help boost the ignition by putting several spraying or lightly moistening the moxa with alcohol so that you can easily ignite the moxa. But for me, I skip this part. I just use a long nose lighter, light several areas all at once. So this is optional when spraying or moistening with isopropyl alcohol. Just use sparingly. Just use sparingly. Then you use a lighter to immediately ignite the area moistened with alcohol for faster ignition. And then ideally, you stay and monitor the patient for the safety. So the duration of this one can take 20 or more minutes. On average, it takes between 20 minutes to 30 minutes. And then make sure your ventilation or the windows are open because this is very causing a lot of smoke. So it's like fumigating the room. Also, at the same time, it disinfects the whole room area. So after the burnt moxa has cooled completely, you can use the hands, both ends, to lift the moxa so that easily for cleanup. Make sure, be very careful not to drop the ashes, the burning ashes to the patient's body, and then dispose it in a receptacle with no flammable materials. And then what you can notice once the procedure is done, the whole area where you applied your long snake moxa will have redness and possible blisters. So make sure to do your aftercare of the long snake moxibustion. Generally, once the treatment is completed, you allow the patient to sit, relax, and prepare themselves to go back out into the world. So usually they rest for 5 to 10 minutes. And then sometimes when they get up, they get up very quickly, some of them may feel lightheaded or adrift. So always assist your patient and then encourage them to return weekly until the condition has resolved. Although technically you can do a long snake mox once every other week or once a month as well. So this is a very intense procedure of moxibustion. But when you do it, most patients will feel very good afterwards because most of the whole length of the dome meridian where the sea of yang flows, you stimulate all of them or augment all of them by using the moxa heat so as to tonify your yang qi. Okay? Other people, such as me, would also practice your thunderfire moxa. So a thunderfire moxibustion stick comprises of a 100 gram of moxa wool and some other ingredients such as your dried ginger, eaglewood, nototherigium. Others would have more ingredients such as yours safflower that can help with blood circulation, other kinds of warming modalities, Radix angelicae sinensis or your Dang Quai that can help boost the chi and blood or nourish the blood, especially for the females. Yes, that's a very good arsenal to have. So a thunderfire moxa generally is a times four of our normal moxa stick. So it is roughly a 4 centimeter diameter. So it is four normal size moxa stick coupled together. So for me, I use this one specifically for severe deficiency cases, and if I want to stimulate a larger area. So you have many different versions of Thunder Moxa, but most of them on average would have 4 centimeter diameter. Some of them would be marketed as a female regulation type of Thunder Moxa. Others would be marketed for meridians and collateral types of Thunderfire Moxa together with a calming type of Thunderfire Moxa. So all of them would have different ingredients. They vary slightly differently in their ingredients so as to suit their respective functions. But for me, they have a common denominator of a 100-gram moxa wool stimulates a more larger area of moxibustion. So for female cases suffering from infertility, especially with liver chi stagnation and cold invading the uterus, you might want to consider the option of buying a Thunderfire Moxa, specifically the female type of Thunderfire Moxa. So nowadays, we are lucky. AcuQuest and even JAJM sells this nowadays. So it is easily accessible. And you can just contact them because they are our local trusted acupuncture material suppliers. Okay? So, moving forward, after finishing the spectrum of Eastern medicine, let's now go to the spectrum of Western medicine in terms of moxibustion. Last September 12, 2013, came out this article by the Chinese. So, the mechanism of moxibustion, an ancient theory and modern research. So, they are trying to elucidate how moxibustion work in terms of Western medicine. So if you remember, moxa has a dual effect of tonifying and purgating or reducing in TCM theories. So it acts on the meridian system and the roles of moxa and fire. Not to mention what they found out that moxibustion, aside from the heat, the thermal effect, moxa has radiation effect, pharmacologic effect, and your smoke effect. So the burning moxa radiation spectrum ranges from zero point 0.8 to 5.6 micrometers. The peak is nearby at 1.5 micrometers, lying with the NIR portion. So there is an amazing consistency in the IR spectrum of three types of indirect moxa and the unified spectrum of acupoints. All have their peaks of radiation near 10 micrometers. However, in this study, after doing a thorough research, we are still at the tip of the iceberg because there is still a great distance from fully understanding the mechanism of moxibustion. And in ancient times, it has showed that in China, from way back in the 1950s down to the last decade, it can treat around 364 kinds of diseases can be treated using with moxibustion. So it can range all the way from dysmenorrhea to arthritis to pain syndromes to asthma to herpes zoster, etc., etc. So, traditional moxibustion theory. So, TCM theory holds that it has a dual effect, once again, of tonifying and reducing. And the characteristics of moxibustion in materials and using fire determine that its efficacy is inclined to warming and nourishing. So, moxibustion is often applied in deficiency cold syndrome. But interestingly, in this article, they found out that some excess heat syndrome can also use it. So nowadays, they're also challenging the ancient belief or the common textbook belief that excess heat is contraindicated. So the roles of moxibustion can be broadly grouped into warm nourishing, warm dredging, and warm melting. When you say warm nourishing, it refers to the benefits of warming yang, tonifying qi, nurturing blood, and relieving depletion or deficiency. Warm dredging refers to the functions of activating blood, dissolving stasis, promoting qi and blood flow, dredging the channels, and relieving pain. Warm melting refers to the roles of reducing phlegm, eliminating stagnation, removing wind, dispelling dampness, drawing out poison, and purging heat. Some people believe that warm dredging is the nature of moxibustion and is the key role of moxa effects. So the function of moxa, aside from expelling cold, promoting circulation, clearing away heat, detoxifying, so forth, are dependent on your circulation of qi and blood flow, much like acupuncture. So the TCM usually takes needling and moxibustion collectively, for both of them are similar therapeutics based on the same theory of meridian and acupoints. So moxibustion is closely related to meridians, cutaneous regions, and acupoints. So the meridian systems, I'm sure you're very familiar already with our 12 meridians plus the do and run meridian. So they are communicating internally and externally, regulating the flow of qi and blood of the whole body. So in the moxibustion treatment process, the acupoints are the terminals of the meridian system. Through the meridian system, moxibustion can reinforce insufficiency and reduce excessiveness and directly correct the disease state of the human body or activate the meridian system for self-healing function and play a therapeutic role. So traditional moxa theory relies on the meridian system and your acupuncture points. So that's what you stimulate in TCM so as to exert the effects of moxibustion, much like acupuncture. And they also mentioned moxa and the fire. So remember, on moxibustion fire in TCM, there's a discussion in your Chen Xiao Lun stating that moxibustion using fire, fire being hot and rapid with soft body, can bear with that to eliminate the shadow. It can move instead of stay and always go into the organs. Fire is hot, so it can warm back the yang and eliminate cold of the yin. Even it can melt the poisoning things caused by multiple pathogens. fire is speedy, so it can dredge the channels, remove the pain or numbness, and activate blood and chi. So, the feature of moxa fire shows the main role of moxibustion. Remember, moxa fire is warm without dry, and it can ascend and descend with strong penetration and ability into the viscera. So the Compendium of Materia Medica said that moxa leaf are slightly bitter and over spicy when raw, and it will become slightly spicy and over bitter when processed. So that's why moxibustion, you can use this for dampness because bitterness dissolves your dampness. So moxa with the nature of pure yang, raw moxa is warm and become hot after processing. So what we are using nowadays are the processed moxa. So they have a hot nature as well. So they are more suited for deficiency cold syndromes. It can take the Taiyang fire and get back the dying yang. So remember, it restores yang qi from collapse. It can go through the three yin, get rid of all the cold and dampness, and turn the cold into warm after taking orally. Moxibustion with moxa leaf, again, can cure hundreds of diseases with great function. So the drug properties of the raw moxa leaves is that after becoming processed, they become suitable for moxibustion and more hotter in nature. And some moxa ingredients, um, taking note of the moxa age for processing, the older the better. So the ancients chose moxa as moxibustion material for it is easy to collect and more for its drug properties, and long-term clinical practices have proven that. So, modern analysis, scientific research about moxibustion states that on thermal effects, burning moxa without flame can produce a high temperature of around 548 even to 890 degrees Celsius. So it can give a warm feeling when it is close to the body. So some people think that this treatment is a thermal physical effect. And did you know a 2 milligram moxa cone on mice abdomen? It raises the temperature outside the skin 130 degrees Celsius and inside the skin 56 degrees Celsius. The same changes of temperature were not observed in the forelimb far away from the stimulation site. So very interestingly, moxa is very hot in nature. It can alter our skin temperature, thereby stimulating the body to activate some immune pathways to promote a healing effect. By using 50 milligram of moxacone direct moxibustion on the skin, the epidermal, subcutaneous, and basal layers were different. The results suggested that moxibustion thermal stimulation affects both shallow and deep tissues of the skin. The maximum temperature changed by indirect moxa, not direct moxibustion. Indirect moxa was about 65 degrees on the skin and 45 degrees on the subcutaneous layer. So even an indirect moxa can raise your temperature from our normal body temperature of 37 degrees all the way up to 40 degrees, 45 degrees Celsius, even to 65 degrees Celsius. The thermal effects of different moxibustions are not the same. So they try to analyze your direct moxa, ginger separated moxa, suspended moxa, light moxibustion, and your helium neon laser moxibustion. All of them except the helium neon laser moxa has significantly changed the temperature of the acupoints through the skin to the muscularies, and each had their own rules and characteristics. So it states that the efficacy of moxibustion depends on the temperature changing of the acupoints caused by moxibustion. So, so moxibustion with different types would have different effects. So variable would be the acupoint sensitivity as well as the moxibustion material. So these are the things that you consider when elucidating a thermal effect of moxibustion. And others have observed that moxibustion effect and the intensity of thermal stimulation through the change of pain threshold. So increasing the burning moxa amount unit per time can significantly improve the immediate analgesic effect and lingering effects. So a stronger and more frequent moxa technique and practice can have more pain relieving effects and other multiple systemic effects. And one of the things I want to emphasize is that a noxious thermal stimuli, meaning when the patient starts to feel pain because of the burning heat of the moxa, it indicates that your temperature is already at 44 to 52 degrees Celsius. So when you reach already this range, when you have a noxious thermal stimuli, that will activate your SRD neurons, thereby exerting multiple physiologic effects. So much like acupuncture, when we stimulate them to have the Tzi sensation or the Qi sensation, moxibustion, you can also do something similar by having a pain or discomfort using the heat. That will tell you that that is an enough stimulus to stimulate your SRD neurons to exert multiple physiologic effects in the body. So, the warm heat effect of moxibustion has a close relation to the warm receptors and the polymodal receptors. The antipyretic and thermolytic effects of moxibustion are achieved by stimulating the polymodal receptors of the acupoints. So a very important concept when you're doing moxa, always ask the patients if they can feel a noxious thermal stimuli. Once you're able to feel that, you can now then bet or assume that the body will start to act on it systemically. So the effects of mox on the skin can appear as hotness, flushing, redness, pain, blisters, and other skin irritations and burn phenomena. Interestingly, did you know that moxibustion leads to a vasoconstriction at the burning acupoint while dilating the around the point and increasing peripheral arterial blood flow and microvascular permeability? So very interestingly, when you look at the moxibustion acupoints, you can see a redness at the site area. So the redness at the site area doesn't necessarily mean a burn injury. Physiologically, based on research studies, they found that it vasodilates your blood vessels, hence giving you a redness at that area. Another one that I want to emphasize is HSP or your heat shock proteins. So once you have a noxious thermal stimuli, you activate your heat shock proteins. So heat shock proteins are a group of proteins that function to reverse or inhibit denaturation or unfolding of cellular proteins in response to stress or high temperature. And then heat shock proteins is actually the first line of protection for cells exposed to stressful conditions. So, the HSPs induced by moxibustion may be an important factor for its mechanism of action. Because when you stimulate the HSP, you stimulate the unfolding of other proteins that are deemed to have beneficial effects on the body. So, these are another interesting concept that happens in the cellular level when you do your moxibustion. So a very interesting theory is the SRD neurons and HSP. When you do your moxa, once your patient feels pain, you can bet your SRD neurons are stimulated and your HSPs are activated, thereby giving a total healing benefit over the whole body. So that is one interesting concept they discovered as to how moxibustion can achieve an overall physiologic effect to the body. And number two, interestingly, they found out that moxa has a light effect or a radiation effect. So by irradiating by a heat of 40 to 43 degrees Celsius, there are no significant changes in the tail flick latency or vocalization threshold, and not any thermal stimulation can achieve moxibustion efficacy. Interestingly, they pegged that the burning moxa emits visible light and IR radiation. Therefore, besides the heat effects, non-thermal radiation effect may be an important role in the efficacy of moxibustion. So at present, what they found out is that the ignited moxa has a range of zero point 0.8 to 5.6 micrometers, and then it lies at the NIR portion. Much like when you do your laser acupuncture, the preferred one would be the IR range because IR penetrates your acupuncture points at 5 to 7 centimeters deep. So the thermal radiation of a burning moxa stick actually lies in your IR range, no? So for the moxa stick, it is pegged near your FIR and near NIR with a spectrum of 2.8 micrometers. So when people ask me, moxibustion is as good as acupuncture because in a sense, Moxibustion is very similar to laser acupuncture in terms of having an IR light effect. So remember, your IR laser light can help stimulate your cells, your mitochondria, boosting your citric acid cycle and your electron transport chain to exert a physiologic homeostatic effect. So moxibustion is a very good counterpart of acupuncture. It's also a very good alternative for those that are scared or afraid of needle puncture. So worry not, moxibustion has also light effect and works similarly with laser acupuncture. So the drug moxastic is distributed from the red light to the NIR, but they lean more for the IR range. And here, when people ask me, like Dr. Webb, how come you prefer the traditional moxa stick instead of a smokeless moxa stick? I would always go to this slide because the traditional moxa stick, when you measure the intensity of radiation or millivolts, they tend to be 43,300. As compared to a smokeless moxa stick, the radiation intensity is just 31.15. A cigarette with a brand of 555 has even more higher intensity of radiation. So the radiation effect or the light effect per se are much stronger than a traditional moxa stick, a smoke moxa stick, not a smokeless. So this is one reason why I tend to practice more of the traditional smoke moxa stick. And interestingly, when you do an indirect moxibustion, take a look at the hot ingredients or those with the warming properties such as a monk should, a ginger, and the garlic. They are at the range of 500 to 600 radiation. If you change that with the cool ingredients such as your neutral ingredients or cooling ingredients, much like a cucumber and a carrot, take a look at the radiation. It significantly becomes one half attenuated one half immensely. So what does that tells us? It tells us that the property of your TCM herb or material matters. So when you do a moxa, it is best paired with a warming ingredient or a hot ingredient such as your aconite. So you can amplify the effects of moxibustion in terms of providing heat and warmth to the body and tonifying your yang qi. Not to mention, thermal effects are produced under the action of electromagnetic waves. The human body molecules absorbs energy from the IR and convert it into heat, thereby promoting blood circulation and improving the cell and enzyme activities. So, the non-thermal effect is related to the interaction of the electromagnetic waves and organism, and the actions of NIR and FIR on organisms are different. So NIR or your near infrared is generally believed to play the major role in the biological radiation effect of moxibustion, and it can stimulate your cells, specifically your mitochondria, to produce ATP that can be used in a lot of multiple physiologic processes of the body that can exert a beneficial effect to overall health, hence restoring or maintaining a homeostasis condition for the human body. So when NIR irradiates the body, the light reflected by the skin is relatively low. The energy can be transmitted about 10 millimeter or 1 centimeter deep into the skin, reach the tissues, and be absorbed by them. So the NIR effect produced the tissues are absorbed by the connective tissue, blood vessels, lymphatic vessels, and nerves, and enhance the metabolism and thermogenesis of the organs they reach. So they can alter metabolism and help with the overall regulation of the body. And most importantly, it can energize the metabolism of the human cell. So the energy generated by the photoelectric effect and photochemical processes and pass through the nerve humoral system can provide the activation for the pathological cells lacking energy and then further adjust the body's immune and neurological function. So moxibustion not only works on acupuncture points, it also works at the cellular level, specifically energizing the metabolism of cells by activating your electron transport chain and activating your mitochondria, thereby providing your ATP distribution throughout the whole body so that your body can function more effectively, hence having a more stronger immune system and neurologic function. Okay? The third mystery for moxa is the pharmacological action. So another reason why I tend to lean for more for the traditional moxa is because your traditional smoked moxa has a pharmacologic effect. It is made of the mugwort plant, your Artemisia RG or Artemisia vulgaris, whereas a smokeless moxa is just made of carbon or even charcoal. So for me, I tend to lean more for the traditional smoked moxa. So the mugwort leaf can produce moxa wool after drying and grinding, which is a common moxibustion material. The ingredients of moxa are complicated. Actually, they found out more than 60 kinds of components had been identified. So the volatile oil rates include your cineol, your alkenes, your camphor, borneol, ketones, phenols, alkanes, and benzene series compound. And heptatriocontain plays an important role in combustion. So that's what makes your moxa burn continuously, successively. And they also found out that moxa has tannins, flavonoids, sterols, polysaccharide, trace elements, and other ingredients that can help with the antioxidation effects and boosting the immunity of the body. And the ingredients of moxa always change according to the place and season of production. Before it was Chicho. Nowadays, in modern research, they would tend to lean more of the moxa in Hubei province. Hubei in Sichuan County, Hubei province, because that area has adequate rainfall, good climate, and a good soil for producing your Artemisia RG species, hence providing the highest quality of moxa. So for those of you wondering where is Hubei, it is located somewhere at 30 degrees with north latitude and 115 degrees east longitude. So here is the Hubei province. Hubei province has a lot of counties as well. So that is in China, somewhere here at southeast, at the eastern part of China. So some people had measured the heat combustion from different kinds of moxa, and they found out that the heat combustion effect from Hubei province of the moxa was pegged at 18,139 joules per gram. The northern type of moxa was at 17,463. TI from Hebei from the other provinces also at 17 and 16,000 respectively. So with the modern research for heat combustion effects or intensity, the combustion heat from Hubei was the biggest and has been considered to be the best moxibustion material since the ancient times. And interestingly, the volatile oil rate of moxa is at 0.45% to 1%. So a volatile oil is a substance of oily consistency and feel, especially one that is derived from a plant tissue such as your artemisia, and that is the one that you harvest, no? Most likely used for essential oils. So it has a variety of activities in the body, such as expansion of the airway smooth muscle, relieving cough, expectorant effect, and strong antioxidant activity. That's why moxibustion can be used for lung problems, such as cough and colds, asthma, pneumonia, tuberculosis. Not to mention, the moxa is also rich in flavonoids and polysaccharides, which have a strong antioxidant activity as well. And the moxibustion combustion test showed that the relative equilibrium moisture content was 13.51%, relative ash content 11.77%, relative smoke production rate was 126.42%. And they found out when doing moxa, burning moxa, some moxibustion combustion products have brown tar-like substances. So for those of you practicing the traditional smoke moxa, sometimes when you look at your box or your equipments, they have this stain like a viscous tar-like substance. Because remember, Moxa is made from the natural plant Artemisia. They have essential oils, volatile oils. That's the one that produce your brown tar-like substances. And the moxa and combustion products have the actions of clearing the free radicals and lipid peroxidation. So this is a process wherein the oxidants such as free radicals attack your double carbon bonds, especially your polyunsaturated fatty acids. So the result indicated that the active ingredients of moxa were increased rather than being destroyed after burning. So remember, when you ignite a moxa, it as the time goes on, it becomes more hotter, more stronger because when you ignite a moxa, the active ingredients are increased rather than destroyed, hence providing a higher heat stimulation effect. And then when they do a liquid gel chromatography, they found out that inside the moxa components, they have antioxidant components found in band 4. And then the antioxidant effect in band 4 is 0.14 is better than the synthetic antioxidant BHT. Ginger and garlic, respectively, have confirmed that gingerol and allicin, the active ingredients of them, could act on the body by heat to give therapeutic effects. So again, a very important thing to consider when doing moxibustion is the type of insulating material you are using. Ginger and garlic are of warm and hot nature properties, so you would tend to lean more on them when using your insulating moxa via indirect moxa. And the extract of moxa combustion ashes also have anti-free radicals. So remember, another thing they consider is the smoke, because the smoke contains a variety of components and volatile ingredients such as your ammonia, alcohols, hydrocarbons, terpene compounds, and their oxides. Not to mention, when they analyzed the smoke of burning moxa, did you know they were able to isolate 61 peaks and identify 26 ingredients in the moxa smoke? So in the first 10 minutes, you have your furan structure substances, followed by the aromatic compounds in 10 to 40 minutes, followed by 40 to 70 minutes, your ester alkanes and hydroxyl containing compounds. So what is so important about the smoke? Why am I leaning more to the smoke moxa rather than the smokeless? Because the smoke of the moxa can be used for air disinfection as an antiviral and antifungal. So this is one of the reasons why those during the COVID-19 epidemic or pandemic, moxibustion practitioners rarely get infected with COVID because the smoke per se of the moxa disinfects the entire environment. So the smoke of moxa, aside from antiviral and antifungal, it has applications in wound infections, vaginal itching, uterine prolapse, anal fistula, and common warts, and so on and so forth, and showed that the smoke of moxa would make effects on the body through breathing. However, a common stalemate nowadays is there's still a debate on the safety of the moxa smoke because there are some reports showing that moxa smoke may be harmful to the human body, causing allergic reactions. Some people would cough repetitively once being exposed to moxa. Some people's allergic rhinitis may be triggered by the moxa smoke. So for this kind of people, we say that moxa is not suited for them, so you might want to consider other treatment modalities. But generally, inhaling the smoke of moxa have been pegged to have beneficial effects provided it is of sufficient amount and with good ventilation. So remember, the mugwort leaf contains terpenes. It also has polycyclic aromatic carcinogens in the process of combustion, and concentration of air pollutants such as nitrous oxide carbon monoparticulates is tenfold higher than the level of standard class 2 acts which they prefer. However, there is a research way back in 2009 by Wheeler and Kopak stating that does the burning of moxa artemisia vulgaris in TCM medicine constitute a health hazard? And it states there that the short-term and long-term exposure showed that the volatile matter and carbon monoxide generated by the smoke of moxa under normal operating conditions did not exceed the safety level. So meaning it is generally safe provided you have adequate ventilation. Meaning in your clinic, you have at least a window open, you have a adequate ventilation source for so as to dissipate the smoke of moxa. So it is contradicted by the study by Wheeler and Kopak. So stating that moxa smoke generally is safe provided with good ventilation system. So generally accepted view that the meridian system combined with moxa to produce your comprehensive effects. And then acting on the acupoints, the signal enter your CNS and through other pathways to regulate the immune network and circulatory system so as to regulate the internal environment of the body in order to achieve the effects of preventing and curing diseases. There's still a great distance from fully understanding the mechanism of moxibustion. As of now, we do know moxa has thermal effects, it has light effects, and it has pharmacologic and smoke effects. So very interesting concepts with moxibustion based on modern research. Some other very nice EBM research presentation I'd like to share with this article in May 26, 2022 in the Frontiers of Aging Neuroscience entitled Effects of Moxacone Moxibustion Therapy on Cognitive Brain Function and Brain Metabolic Changes in Mild Cognitive Impairment Patients. This is a pilot HMRS study. So as we all know, for mild cognitive impairment or for those suffering dementia, most of them would be prescribed with donepezil and rivastigmine as their maintenance medications. However, you have to consider there are many side effects, safety issues such as diarrhea, dizziness, and insomnia, and the incidence of discontinuation of your dementia meds or cholinesterase inhibitors are quite high. So, one good alternative is moxibustion, safe treatment, and it's effective with few adverse events. Research has proven that moxibustion at DO20, REN4, stomach 36, GB39 have positive effects on cognitive function, especially in your mild cognitive impairment and Alzheimer's disease. Moxibustion at these points could improve the cognitive function of mild cognitive impairment and could reduce neuronal edema in the hippocampus and has beneficial effect for preventing the progression of Alzheimer's disease. So in this study, they were able to screen 234 participants, isolating around 108 participants for your mild cognitive impairment, thereby randomizing them into your drug group, a sham acupoint group, and an acupoint group. So the drug group will be treated with donepezil, with your anticholinesterase inhibitors. The acupoint and sham acupuncture group are treated with different acupoints, but they would still ignite a moxa cone at these points. So for those of you wondering, what were they using? They used DO20, stomach 36, run 4, and GB 39. So for the sham acupuncture group, they use this point A, which is 3.33 centimeter above your GB8, and then point B, which is 10 centimeters on the right side of run 4. Sham acupoint letter C, this is the depression below the bilateral midpoint of the patellar tips. And sham acupuncture point D, it's 3.33 centimeter on the bilateral lateral malleolar tip. So what did they do? They actually ignite moxa cones on this, whether through acupuncture points and sham acupuncture points. Each moxa cones were ignited for 3 to 5 minutes for each time, and they received the treatment every other day. So they receive approximately 30 sessions, 30 treatment sessions every other day, each point for moxacone 3 to 5 minutes each time. So they were burnt with 3 moxacones. 3 moxacones for 3 to 5 minutes for each time, every other days for 30 treatment sessions. So what did they found out? So this is the demographic data. As you can see, there are more females than males. Most of them would be at the range of senior citizen group at the 63 to 66 years old. And then course of the disease would be at 2 years. They're suffering from mild cognitive impairment. And the mini mental state exam, it's very interesting. What did they found out? So for those undergoing moxa at the true acupuncture points, they started at 25.9 at the baseline, and it continued to increase on the first month and second month together with the fifth month. So they improve a score of 3 points for your mini mental state exam. So the mini mental state exam is a examination used to screen for possible cognitive impairment. So you would want a higher score. So generally, the perfect score is a 30 point. So they started at 25, eventually increased to 28. For those taking maintenance medication such as donepezil, it increased in the first month as well as the second month. But take a look. By the fifth month, it also decreases back again to 27. So it's possible that the patient is already having tolerance for your donepezil or your cholinesterase inhibitors. Another very interesting thing to note, take a look at the sham acupuncture point group. You still did a moxa cone, but on a different location, quote unquote, on a wrong location of acupuncture point. But the results, take a look. They started at a score of 26. At the first month, increased to 29. At the second month, it increased to 28.5. At the third month, 28.3. So it mirrors or parallels your acupuncture point groups. So what can that possibly tell us? This one can possibly tells us that as long as you do a moxibustion, irregardless of the correct location of the acupoint, you can still exert a beneficial effect throughout the whole body. Because remember, moxa doesn't act only locally, but it can exert its action systemically. So that can explain why even a sham acupuncture point group having moxa cones there can produce a beneficial effect. Same thing with your MOCA scoring, your Montreal Cognitive Scoring. So the MOCA scoring is much like your MMSE. The higher the scores, the better the cognitive function. It is also a 30-point questionnaire, so you would want a higher score group. So for those undergoing MOXA at Acupoint and Sham Acupoint, they started both at 21, ending at 26. Very parallel, whether true acupoint or false acupoint. For the drug group, they started at 21, improved in the first and second month. But take a look, by the fifth month, it decreased back to 23. So it's possible, again, the medication is not working or they're having tolerance to it. And on a more visual graphic slide, you can see that the yellow line here is the normal control group, meaning they don't have mild cognitive impairment. The one that underwent a acupuncture, meaning the true moxa group at the true acupoints is pegged at color blue. The one undergoing sham acupuncture group is colored yellow. And the one taking maintenance medication, such as donepezil and rivastigmine, are pegged green. So what we can see here is the MMSE and MOCA scoring, both the acupuncture group and the sham acupuncture group, as long as you did the 3 moxa cones for 3 to 5 minutes for 30 sessions, both still exceeded or surpassed the scores of those taking maintenance medications for Alzheimer's and dementia. So what does that tells us? That moxibustion is a very good supplementary treatment for those patients suffering with mild cognitive impairment, or maybe even better than the traditional Western medicine. And in the example of your hydrogen proton magnetic resonance spectroscopy, they found out that before moxibustion treatment in the right hippocampus, the N-acetyl aspartate total creatinine ratio is 1.05 and your choline and total creatinine ratio is 0.84. After moxibustion, take a look. It became more redder, more active. It indicates that at the end of the second month of the treatment, in the right hippocampus ratio, the NAA total creatinine ratio is 1.40 and the choline total creatinine ratio is 1.10. It indicates that your brain uses more, functions more, or functions better. Hence, you have a higher ratio as what you have begin with before you had your moxa treatment. So your moxibustion improves your brain functions. And in conclusion, patients with MCI showed reductions in NAA total creatinine in the bilateral hippocampus, bilateral posterior cingulate gyrus, and choline total creatinine in the right hippocampus, which might result in cognitive dysfunction. The study suggests that regulations of your NAA total creatinine in the bilateral hippocampus, bilateral PCG, and choline total creatinine in the right hippocampus may be the major brain pattern of response to moxibustion treatment for mild cognitive impairment. So this is a very interesting study for those undergoing moxibustion, thereby improving their mild cognitive impairment. So for those of you practicing moxibustion, this may be a very good arsenal to have to help treat our senior citizen relatives or patients suffering from mild cognitive impairment. Moving forward, in January 27, 2022, came out a study by moxibustion for primary dysmenorrhea adjuvant therapy for pain relief. We know that moxibustion plays a role through its four actions: the heat effect, light effect, moxa smoke, and drug effect. Moxibustion treatment for primary dysmenorrhea focuses on adjusting endocrine hormones, regulating immune function, neuro-related factors, and improving uterine microcirculation. We all know that moxibustion works well, especially for females suffering from dysmenorrhea, female problems, infertility cases, PCOS. Yes, it can work. And they found out that moxibustion not only acts on the uterus, it can help with your endocrine hormones, reducing your prostaglandin ratio, increasing serum progesterone, and reducing estradiol, reducing ABP and oxytocin, thereby helping in dysmenorrhea, regulating the imbalance of your immune cells, increasing the number of mast cells, and activating NK cell activity, improving neuro-related factors, improving your opioid receptors and pain relief. And for the uterine microcirculation, it reduces your pulsation index, resistance index, blood flow velocity, uterine contraction and frequency, and intensity, improving microcirculation. And interestingly, they also act on the brain, regulate the intensity of brain metabolic activities in pain-related brain regions, and the coordination of local neurons. So very interestingly, moxa has multiple systemic effects on the hormones, immunity, neuro-related factors, uterus, and even the brain. So in this study, they tried to compile multiple study literature. So I just wanted to show you what are their points they use. Some of the studies use GB4 or CB4, Guanyin, for 40 minutes, 5 days before your menstruation. And then your mean pain scores were lower. Some would go for ginger moxibustion at CV8 together with your acupuncture at spleen 6, stomach 36, LI4, and PC6 once a day, 5 days before menstruation, continued for 7 days in each menstrual cycle. And then they have instant curative effect, recent curative effect, and long-term curative effect in the treatment group were better than those in the control groups. Other studies, they use moxibustion for your CB4 once daily, 7 times in total, 5 days before menstruation, and they have effectivity rate at 44.89%, and the total score of symptoms were significantly reduced. For those using thunderfire moxa, yes, they did treat the thunderfire moxa at the area of the lower abdomen, and they have good treatment outcome. Some of them, they use a drug-spreading moxibustion at the lumbosacral acupoints area and also at the lower abdominal area near your CV regions. Other study would use thunderfire moxa at CV12, CV4, stomach 36, 30 minutes per time once a day for 3 consecutive days, and all would have good results as well. Some would use abdominal moxibustion in the umbilicus plus abdominal acupuncture. Others would go for warm needling at CB4, spleen 6, and CV8. So they have good, interesting results, better clinical efficacy in the treatment group. So, in summary, that primary dysmenorrhea is the dominant disease in moxibustion. So, this research expounds the mechanisms of the heat effect, light effect, moxa smoke, and drug effect of moxibustion, and research on the treatment of primary dysmenorrhea by moxibustion by regulating your endocrine hormones, improving immune function, regulating nerve factors, and improving uterine microcirculation. So as what you can see, different types of moxibustion modality on different acupoints would produce a common denominator of improving primary dysmenorrhea with several proposed pathways. So moxa can not only have an analgesic effect in the short term, but also have an excellent long-term analgesic effect in the treatment of primary dysmenorrhea. So there are two possible circuits for moxibustion to relieve pain in primary dysmenorrhea: the frontal cortex basal ganglia cerebral cortex with the lenticular nucleus as the critical component, and the second one is the parietal basal ganglia marginal frontal lobe. So both pathways can promote the expression of goal-directed behavior through emotional regulation. So when you do moxibustion, in a sense, you influence the neuroanatomy and nervous system as well. However, their conclusions. Moxibustion is effective in treating primary dysmenorrhea. However, they cannot pinpoint which one is the one responsible for its effectivity. Second, few studies focusing on the wave peak of moxibustion in recent years, and there's no unified conclusion. Third, the mechanism of moxibustion for primary dysmenorrhea focuses only on these mechanisms, whereas the others are still remain to be discovered. Finally, we lack the neuroimaging technology. So hopefully in the near future, we can find more, unravel more effects of moxibustion in our human body. But as of this point in time, it is very interestingly that moxibustion not only acts locally, but they can also act systemically by having a lot of multiple systemic effects in the human body. Okay? So, also, did you know in July 17, 2020, in the World Journal of Acupuncture and Moxibustion, thoughts on the effects of moxa smoke in the epidemic prevention was published. And this one, it recognizes the moxa smoke as a way of air disinfection and the clinical application of moxa smoke so as to provide the references to the prevention and control of COVID-19 in TCM. So this one came out during the peak of the COVID pandemic. So they tried to analyze the role of moxa smoke by preventing COVID-19. So, as early as the ancient classics, the ancient scholars believed that your moxa is pungent and warm in nature, aromatic in flavor, acting on strengthening the body, preventing disease, and removing disorders by fumigation. Hence, moxibustion by fumigation is the common method in the epidemic prevention. And in the emergency formulas to keep up on one's sleep, the strong moxibustion on the four corners of the patient's bed, one moxa cone on each, achieves the best effect on preventing from epidemic infection. Fumigation with moxa and your tangzu is applied for the epidemic prevention. And the essential oil from burning your moxa is mainly composed of eucalyptol, borneol, terpene, alcohol, acting on sterilization, anti-inflammation, antivirus, suppressing cough, relieving asthma, and strengthening immunity. Clinical trial proves that moxa smoke fumigation achieves the same or even better effect as compared with room air disinfection and UV disinfection, and this method is not influenced by temperature and humidity. So it is very interesting to note that moxa smoke is equal or maybe even better to UV disinfection. So the mechanism of moxa fumigation in the epidemic prevention was analyzed in this research article. And they found out that the blocking the aerosol transmission route is of great significance for the prevention of epidemic. So researchers show that moxa smoke achieves its role by prevention by killing your viruses using the smoke. Moxa smoke achieves prevention role by killing pathogenic bacteria and forming a micromembrane barrier. So, Ray Hong et al. Burned two moxa sticks once every 2 days, 1 hour each time in the ward during the flu season, and they found out that moxa fumigation effectively kills the virus and reduces the incidence of influenza to 0%. The disinfection effect is better than that of dynamic air disinfection machine. Hong Mei Chow et al. Had adopted the same method at the baby ward, and it also indicates that moxa fumigation presents an inactivation effect on hepatitis B virus, Hepa B antigens, and Hepa E antigens. So the one that's responsible for transmission of your hepatitis B virus. Xiaorong Hu et al. Fumigated a hematology ward with 25 grams of moxa stick for 60 minutes. It found that moxa fumigation has significant sterilization effect on common pathogenic bacteria such as Pseudomonas aeruginosa, Staph aureus, and Candida albicans. Moxa stick fumigation for disinfection in the ICU at about 1.33 gram cubic meters, and the elimination rate of natural bacteria in the air is 90%. Yatsin Tang et al. Also noted that moxa stick fumigation in the ward about 1.7 grams per square meters for 1 hour each time, and the average qualified rate of disinfection this year is 94.4%, meeting the requirements for hospital air disinfection. So very interestingly, different practitioners use moxa smoke to disinfect for different types of viruses and bacteria. And it also notes that disinfection effect of moxibustion among different doses. They tried to analyze a 2.5 gram versus a 5 gram and 10 gram per square meter respectively, and discovered that the antibacterial effect of each dose group is 100% in 24 hours after disinfection, but no effect in 48 hours after disinfection in the 2.5 gram per square meter group, and in 96 hours after disinfection in the 5 gram and 10 gram per square meter groups. So it is believed that the persistent time of disinfection with fumigation of the moxa smoke by your Artemisia RG or Artemisia species is within 3 days. So the fumigation of the moxa smoke not only inhibits or kills bacteria and viruses in the air, but also forms a micromembrane barrier in the mouth and the nose to prevent invasion of the influenza viruses. A very interesting finding about moxa smoke in terms of preventing not only COVID, but other airborne transmission of flu and influenza, and etc., etc. Not to mention, moxa improves immunity, regulating the concentration of immune factors such as your interferon, immunoglobulin, interleukin, which affects the body immune system from different aspects. So moxibustion increases the levels of immunoglobulin, improving immunity. Moxibustion increases your CD3 plus and ratio of CD4 to CD8 serum T cells, enhancing the clinical effects in patients with tuberculosis. Moxa improves the immune function of the RBC and improves the T cell subsets in the athletes. So it is also discovered that moxibustion is assisted in the antiretroviral therapy for human immunodeficiency virus, improves the immune indicators such as CD4, IL-2, IL-7, significantly reduces the incidence of adverse reaction, and improves the quality of life of the patients. So controversy on the safety, it's still controversial, but some studies suggest that a certain concentration of moxa smoke is relatively safe. According to the Bai Xiao Chow's research team, they evaluated the accumulated toxic reaction of particulate matter in moxa smoke and in its influence on serum free radicals, and concluded that the toxic reaction of moxa smoke in low and medium concentration groups was not significant and its harm to the human body was not obvious. The safety of moxa smoke, because moxa smoke could not cause abnormal changes in physiologic indicators such as your vital signs in healthy people. So it is relatively safe when you do your moxa, provided you have adequate ventilation. However, there are some reports stating that some physicians practicing moxa in the smoke environment had an incidence of 26.67% and 61.11% had pharyngeal discomfort or cough after moxibustion therapy. So they calculated the limit of human safety was 2.75 milligram per cubic meter. Most researchers believe that harmful substances can be controlled within a safe range by constructing a good exhaust ventilation system. But attention should still be paid to the air quality problems caused by the moxa smoke. So worry not, it is generally safe provided when you do your moxa, you have a window open or an adequate ventilation. Okay, moxa is generally safe. For those people that are sensitive to the moxa or moxa smoke, we ask them first to wear face masks or gas masks if possible, so as to reduce exposure to smoke. And if it is really not effective, then we say that they might want to try other modalities. Moxa smoke is not suited for this kind of people. Again, there's still a gap in understanding what substances or material groups play a role in moxa smoke, necessary to specify the harmful threshold dose. So no one has done yet the threshold dose for the moxa smoke. Hopefully in the future we can have some. And moxa smoke plays its anti-fatigue effect in the response of nervous system and the regulation of free radical metabolism through nerve endocrine immune system. So some people, when inhaling the moxa smoke, they feel refreshed, revitalized, because the moxa smoke plays an anti-fatigue effect in the nervous system. And moxa smoke may also prevent atherosclerosis by observing the impact of moxa smoke on blood lipid metabolism and microcirculation. Moxa smoke extract may regulate the expression of neuronal apoptotic proteins and antagonize apoptosis to delay the progress of neurodegenerative diseases. It is believed in TCM that the heart and lung functions are involved in all of the researches focusing on the relationship of the chi and blood. So, the therapy, in summary, the therapy of moxibustion, your moxa smoke, is to be promoted in the aspect of prevention of virus transmission, not only in the hospital, but at home, at your clinics. So for those of you practicing moxibustion using the traditional moxa, I hope this will keep you motivated to practice the ancient art of moxibustion. Okay, so keep up the good work. And last but not the least, I would like to present 2018 moxibustion treatment that modulates the gut microbiome and immune function in a dextran sulfate sodium-induced colitis rat model, according to the World Journal of Gastroenterology. So here in this study, they divided several groups, healthy controls, together with an ulcerative colitis model. Ulcerative colitis rats group treated with 1 week of moxa and 14 days of moxa versus the gold standard for ulcerative colitis treatment, followed by healthy control groups with 1 week and 2 weeks of moxa respectively. Where was the point of interest? Bilateral stomach 25. Bilateral stomach 25. What did they use? A moxa cone, 0.5 centimeter in diameter, 0.6 centimeter high, placed on a herbal cake. The herb cake was placed on stomach 25. Moxibustion 10 minutes once a day for 7 days. And then a size of 1 centimeter in diameter, and skin temperature of Acupoints was pegged to be 43 plus or minus 1 degree Celsius. So it is near the threshold for noxious thermal stimuli at 44 degrees Celsius. So what did they found out? They found out that Moxibustion treatment restored the colonic mucosa and decreased submucosal inflammatory cell infiltration in colitis and rats. Rats treated with moxibustion and mesalicin had significantly lower levels of the dominant phyla Proteobacteria and the genera Spingomonas barnacella in colitis rats. They could restore the microbiome to levels similar to those observed in healthy rats. The findings suggest that the short term, but not the long term or 2 weeks of moxa, may significantly affect the gut microbiome. So compared with the healthy group, the levels of the cytokines interleukin, these levels were all increased, whereas the anti-inflammatory cytokine IL-2 and 10 and TGF-beta were decreased in ulcerative colitis model in rats. Interestingly, these changes were reversed by moxibustion. So they decreased the inflammatory metabolites and increased the anti-inflammatory cytokines. So again, these are the healthy controls. These are the group with ulcerative colitis. Those with ulcerative colitis that underwent 1 week straight of moxa, 2 weeks straight of moxa. Those groups ulcerative colitis that underwent with lavage. Healthy control groups with 1 week and 2 week moxa. So let's analyze. So here in the healthy control group, you can see the colonic mucosa relatively intact. For those with ulcerative colitis, in the histopath slide, you can see this one, the ulcer per se. This cavity here, that's your ulcer. For those with ulcer that underwent 1 week of moxa, take a look. From a wide gap of ulcer, it now still has an ulcer, but it is relatively narrow. Very interesting. For those that underwent 2 weeks of moxa, your ulcer from this gap has become this only. So it has reduced. Very interestingly, moxa can help with ulcerative colitis by modulating your gut microbiome. For those underwent the gold traditional standard Western medicine treatment for ulcerative colitis by mesalazine lavage, yes, it also improves your ulcers. But for those with healthy controls undergoing moxa, it has also as a proliferation of your colonic gut microbiome. As you can see, more darker, more violet, more pleomorphic nucleus. So very interesting findings for ulcerative colitis on pathology slides. And then for those scoring the ulcers, so this one are the healthy control groups with no ulcers. These are the rats with ulcerative colitis that did not do with moxa. Take a look for those that does moxa. They have a lower histopathologic score when you do moxa. So this one points out that moxibustion helps with ulcerative colitis by influencing your gut microbiome and immune function. And here are the levels of your cytokines. I just wanted to show you here that your anti-inflammatory cytokines in the colonic mucosa, such as your IL-2, IL-10, and transforming growth factor beta, take a look. When you do a moxibustion, your anti-inflammatory cytokines increases. The rest of the inflammatory cytokines, take a look. From ulcerative colitis, take a look at the red and the green. All of them decrease. This inflammatory cytokine decrease, this one decrease your IL-17, IL-23, TNF-alpha, TNF-FR1, FR2, they are all decreased. But for anti-inflammatory cytokine, you would want more anti-inflammatory cytokine. From a decrease, your moxibustion increases it. So all the cytokines pointing to pro-inflammation were decreased, while promoting anti-inflammation were increased. Same thing with the blood levels in the serum. Take a look at the serum. Your anti-inflammatory, which is IL-2, 10, and transforming growth factor beta, they were increased by moxibustion, the red and the green. Here, they were increased. All the inflammatory cytokines were decreased, such as your IL-12, your IL-17, IL-23, interferon gamma, lipopolysaccharide, immunoglobulin alpha, TNF alpha, TNF-FR1 and 2, they are all decreased. So what does that tell us? Moxibustion can significantly reduce the levels of pro-inflammatory cytokines, IL-6, 12, 17, 23, interferon gamma, LPS, TNF-alpha, and increase anti-inflammatory cytokines IL-2 and transforming growth factor beta in rats with ulcerative colitis and reduce intestinal inflammation. Their conclusion, moxibustion can exert its therapeutic effect by modulating the microbiome and intestinal mucosal immunity. So when you do moxibustion at the abdominal area and even at stomach 36, in a way you are promoting your immune system by regulating the free flow of qi and blood and also by influencing your gut microbiome. So these are very interesting modern researches helping to unravel the mystery of the wonderful effects of moxibustion in the body. So I hope I encourage you more to practice moxibustion. I hope I was able to help you burn more passionately about the practice of moxibustion in your respective clinics and help you more to motivate you to do moxa and keep on continuing moxa. And most importantly, I hope to have deepen your level of understanding and knowledge and skills with regards to the ancient art of moxibustion. That's why I strive to give a moxibustion workshop every now and then. So here is our moxibustion workshop at PAAI last September 2022. So this is the first group of moxa post-pandemic that I have handled. So as you can see, I'm a fan of moxa with all of my moxa materials in this workshop. Then we keep the windows open for the moxa smoke. So make sure you have good, adequate ventilation when you do your moxibustion. So I would like to thank each and every one of you for your kind attention, for bearing with me, for listening for this Moxibustion Christmas free lecture, so as to encourage you more to learn and relearn the ancient art of Moxibustion. Okay, thank you for listening. And as the PAAI president, on behalf of PAAI, I would like to wish each and every one of you happy holidays, wishing you a beautiful holiday season. And I hope you practice moxa, especially in December when it is cold. Keep the passion alive in terms of burning moxa and reaping its beneficial effects. And I hope you spread the knowledge and art of moxibustion. So with that, once again, Merry Christmas and Happy Holiday to each and every one of you. Thank you very much.